Okay, so this is another case, and clearly there is numerous chromosomal abnormalities and perhaps some amplification on chromosome 9. Next slide. When we look at the expression profiling, and again, our software for the RNA called it correctly as sarcomas. I should really add, at this time, we are collecting cases, and if you look at the categories or the diagnostics that are listed in the column here on our AI software, we are increasing this list of diseases. So currently we are lumping all the sarcomas together, but as we collect more cases, we are going to have more subclassifications of the sarcomas and call them, with subclassifications, but we need more cases to be collected in our database. So the software or the artificial intelligence software will be trained for this to call it as such. So this is, again, it's a progress in improving this AI software. Next slide. And if we look at the mutation here profiles, so as you can really see here, there is multiple mutations. The one which is highlighted in red is NF1 mutations, and these mutations raise the possibilities of being germline because it is detected at 50%, which means like it is detected in all analyzed cells in this particular sample, but at the same time, the TP53 mutation is also detected at high level. But at the same time, we detected fusions that involve the PML gene and LOXL1 genes. These two genes are located on chromosome 15, but each one on a different part of the chromosome, one on the P and the second on the Q arm of the chromosome 15s. So it's actually, sorry, it's not this case. Actually, they are both on the same arm and they are adjacent to each other, but because the fusion is, RNA is detected at very high level, we have to call it, so sometimes if the expression level of the fusion genes adjacent to each other at very low levels, that's because of alternative splicing. But when it is very high, we compare it with other sarcomas, and if we don't really detect it in other sarcomas, this is really, we call it as is. Next slide. So these are the abnormalities. The NF1 detected at a high level and raise the possibility of being germline abnormality. In this case, if we test the peripheral blood, we can tell whether this is germline abnormality versus if it is somatic abnormalities. The other things which is very important is the overexpression of EGFR, and there was high BDL1 expressions. As for the fusion between BML and LOXL1 genes, this is really new finding. We don't know what's its clinical implications at this time for this particular case. Dr. Pecora?
Yeah, so this is this was a highly unusual and rare sarcoma that affected this patient. It started in her nasopharynx and in her sinuses. It's been highly aggressive, quite destructive, and she was treated with surgery where they could not do an R0 resection. She then developed systemic bone disease, so it has a bone predilection, but it also involves soft tissue. and she received adriamycin-based chemotherapy, didn't respond to it at all. So she's now receiving combination checkpoint inhibition therapy along with a PI3K inhibitor. And she's actually had stabilization of her disease for the first time. And on her most recent scan, she's starting to show a response. She's not quite close enough to call it a PR, but she's responding. And she's starting to feel a little better. So again, another example where this sort of interrogation led us down a path in an adriamycin-resistant sarcoma to something that might be effective.